My dear students, good morning. I'm talking about the venous drainage of the lower limb today. Now let me introduce you certain basic things about it. The venous drainage of the lower limb is very important because the blood in the venous column ascends against the gravity because the gravity acts upon this blood, but the blood has to be pumped up against the gravity. So this assumes importance because of this. And then there are many factors because the uh, blood ascends against the gravity. Then there are many factors which influence its upward ascents against the gravity, and these include there are systemic or general factors, or there are local factors. And if the mechanism of upward ascent is failed or fails, it can lead to what is called as varicose veins. Now let us discuss what are the factors assisting against gravity, and these are systemic or general factors. First is the negative intrathoracic pressure. When we talk about the intrathoracic pressure, it is always negative, and it becomes more negative while inspiration. So this intrathoracic negative pressure sucks up the blood from the systemic circulation. Then there is arterial pressure or the pulse pressure. This is the pressure which is in the arterial system always, which is actually the difference between systolic and diastolic pressure. And this pressure uh, is actually the pumping pressure which is in the artery, not only in the arterial system, but it also pumps the blood in the venous system also. So the pulse pressure is an important factor by which the blood is pumped against the gravity, not only against the gravity, uh, all around in the whole body, from head and neck, from upper limb, from abdomen, from lower limb. The arterial pressure uh, assists, or arterial pressure causes upward ascent of blood in lower limb. Then we have arterial pulsation. So most of the uh, veins and the arteries, they run together. And in fact, nerves also, so that they're called as the neurovascular bundle. Now, in neurovascular bundle, the arteries and the blood vessels, they run together. And when the arteries pulsate, when the arteries dilate, they bring about a pressure from the accompanying vein, and this accompanying vein, then by virtue of the pulsation pressure, it pumps the blood against the gravity. And then the most important one, the most important systemic or general factors include walls. There are walls in the venous system of the lower limb. They are endowed with walls, and these walls, they permit only one-way blood flow. So if the blood is flowing from below upward, it cannot go up from upward to downward because the valves permit only unidirectional blood flow. Then there are walls also in between superficial within the superficial veins, and as well as in deep veins and in perforators. Now these the blood passing from superficial veins to deeper veins is guarded by these walls, and these walls prevent blood flow from deeper veins to superficial veins and the reverse in the reverse direction. So the valves are very important, and because of the valves, the blood ascends in the venous system as a column. Now there are local factors, and the local factors include the number one is that the veins in the and then we have muscle pump also, like peripheral venous, peripheral heart, exolius, or the gastrocnemius. Then we have tight sleep of deep fascia. Tight sleep of deep fascia is important because it is unyielding, and because of this unyielding nature, this does not allow the muscles and the veins and the arteries to yield out, so that the local factors and other systemic factors, they work in perfect tandem with each other. Then there are perforators connecting superficial to deep veins, and these are endowed with valves, and the superficial venous blood flow is directed into the deeper veins, and because of the valves, the blood is not pumped into the reverse direction. Then let us go to the veins of the lower limb. There are three uh, systems of the veins of lower limb. One is the superficial veins, one is the deep veins, and then there are perforators in between the two. So let us discuss the superficial veins first. Now the superficial veins are two. One is the great saphenous vein, one is the small saphenous vein. Now discuss this here. You can see the dorsal venous arch over here, and the medial end of the dorsal venous arch continues or ascends upward as the great saphenous vein. It passes upward in the leg, passes behind the knee for a short while, and then comes again into the anterior medial aspect of the thigh, and it pierces the cribriform fascia in the saphenous opening, and here in the saphenous opening, it drains into the femoral vein. Here, the lateral side of the dorsal venous arch continues as the short saphenous vein or small saphenous vein, and this small saphenous vein, it runs on the posterior lateral aspect of the leg, and then it pierces the deep fascia to become continuous with the great saphenous vein. Here you can see that these are these great saphenous vein and the tributaries of the great saphenous vein, which are actually the superficial veins accompanying the superficial branches of the femoral artery. So the veins over there, they all drain into the great saphenous vein, and then great saphenous vein ultimately drains into the femoral vein here. This is the femoral vein, which is deeper plane, which is in the deeper plane running along the femoral artery. So this is about the great saphenous vein and small saphenous vein. Then we have deep veins also. The deep veins are actually the veins accompanying the arteries of the lower limb. The arteries of the lower limb are, number one, to start with the femoral artery, then femoral artery continues as the popliteal artery. Popliteal artery continues downward, and it divides into anterior, posterior tibial artery, and of course the peroneal artery. Now, the veins accompanying these arteries are deep veins which are ascending upward. So we have femoral vein, we have popliteal vein, we have peroneal vein, we have anterior tibial vein, we have posterior tibial vein. So posterior tibial vein accompanies posterior tibial artery, anterior tibial vein accompanies anterior tibial artery, peroneal vein accompanies peroneal artery, the popliteal vein accompanies popliteal artery, femoral vein accompanies the femoral artery. Now, as far as the clinical anatomy of veins of the lower limb is concerned, the gastrocolius is called as the peripheral heart or calf pump because this pumps up the blood against gravity. Actually, there are perforators, indirect perforators within these muscles. The perforating veins, they bring the blood from the great saphenous vein and short saphenous vein, and then these are coming into the peripheral heart or into the gastrocolius muscle, and the contraction of gastrocolius muscle will squeeze out the blood into the deeper veins, and deeper veins having valves that will pump the blood upward against the gravity. Now here, the important point to note over here is that when a patient or when a person rests or is lying in resting position for a longer duration of time, like when you are flying from New Delhi to New York, it's quite a long distance and you have to be non-ambulant, you have to be sitting for a longer duration of time. And in such a longer duration of time, your muscles may not act, or muscles of the calf may not act or do not act, and in such conditions, the non-contraction of the peripheral heart leads to sluggish venous flow in the lower limb, and this can lead to the embolus formation. The emboli can dislodge from here and can get lodged in the heart, in the what you call the pulmonary artery or pulmonary vein, or in the arterial veins of the brain. So they can cause ischemia, they can cause pulmonary embolism, or they can cause the what you call stroke. So to prevent this, we advise, or you should advise as a physician, that the person should keep the foot moving in dorsal and plantar flexion. The person should keep the foot moving, and person should move, and they should keep the calf the competency of the calf pump is intact and the blood does not come into sluggish flow. The patient may be lying in the bed because there are certain conditions, like when the patient is having a stroke or patient is having unconscious. So in such conditions, the patient may be lying in a bed for very, very longer durations of time, and in such conditions, the peripheral heart will not be acting properly, and this can lead to sluggish blood flow and or even less than sluggish blood flow, which can lead to embolus formation. So the doctor advise the nurse to keep to massage the muscles of the lower limb so that the blood flow is maintained properly. Then we have varicose veins. The varicose veins are dilated veins of the lower limb, and when there is incompetency of walls, This can lead to dilatation, the accumulation of blood in the veins, and then it can lead to dilatation of the veins, and dilated veins are called as the varicose veins. Varicose veins actually are very early in their when seen, they look very ugly, and uh, these varicose veins can eventually lead to what is called as varicose ulcers. Then we have Trendelenburg test to test the varicose veins, to test the competency of the walls of the superficial veins of the wall. The person is asked to lie down, number one. Second, the lower limb, the foot end of the leg is raised upward. This will empty the vein, and this will empty the blood from the veins of the superficial veins of the lower limb. Then third point is to uh, occlude the veins at the saphenous opening by putting thumb over there. Third, this is third thing. The fourth thing is that the person is asked to stand up. When the person is standing, when the person is asked to stand up and the person stands up, this will lead to slow filling of the blood in the superficial veins. But if there is a rapid filling of the blood in superficial veins, that means that there is incompetency of the valves, especially the valves of the perforators. So when the blood after standing in fifth stage, fifth point, when the blood fills up in the superficial veins rapidly, this is called as the positive Trendelenburg test. And positive Trendelenburg test means the walls are incompetent, especially the walls of the perforators. Then we have Perthes test, and Perthes test is for the competency of the valves in the low, in the deeper veins. This is actually for the deeper veins in which uh, there is a tourniquet tied around the thigh, and then the pressure is applied in the tourniquet, and then this is how we test the veins in the lower limb. So that's about it. Thank you very much.